Hi everyone, so this is for lesson 3. We're reading pages 18, 20, and 23 in your book. So open up to page 18 and we'll get going. Okay, so the sickly year theory. By watching the number of deaths closely and seeing as they began to rise each week, John Grant was able to predict a plague epidemic. He looked at all deaths, not just from plague, because he knew the system for recording deaths in London wasn't very accurate. Years before, King James I had ordered each London parish, the district surrounding a church, to begin keeping track of all local births and deaths. Officials called parish clerks were in charge of the records since there weren't enough clerks to track down all the births and deaths in the crowded city. They depended on searchers, like the one who visited Goodwoman Phillips' home, to collect information they needed. This system had a few problems. For one thing, the searchers had no medical background. When it was clear when someone had died from, they had to guess. When it wasn't clear what someone had died from, they had to guess. This led to some unusual entries in the bills of mortality, like teeth, pining, evil, fools, etc., and found dead. In addition, the searchers weren't paid much, so for the price of a drink and a few extra pennies, many searchers would agree to write down anything they were told. When someone had died of plague, their family would be eager to bribe the searcher to cover it up. Otherwise, the whole family would be shut up in the house to prevent them from spreading plague seeds. John Grant estimated that up to 20% of plague deaths were recorded as something else in the bills of mortality. The third problem was that the parish clerks only recorded the births and deaths of citizens who belonged to the official region, the Church of England. This created big gaps in the official statistics because it left out other religious groups: Jews, Catholics, Quakers, and nonconformists. There were a few plague deaths in London through the rest of that cold winter, and as the weather warmed up, the numbers began to increase. In the first week of June, 43 deaths from plague were recorded, as many as there had been for the whole year up till then. The next week, there were 112. By fall that year, 7,000 people were dying each week. Plague had returned to London with a vengeance. Soon, anyone who could afford to leave the city began packing their bags. John Grant stayed where he was. He had his shop to look after, but more importantly, he wanted to keep an eye on the information coming from the parishes each week. His theory about sickly years leading to plague years was being proven before his very eyes. Okay, and this is page 23, Gaunt's Legacy. Gaunt's Legacy. John Grant's discovery that plague years were preceded by sickly years was a huge step forward in tracking diseases. His recommendation that doctors and health officials pay close attention to all unexplained increases in death rates is still helping epidemiologists pinpoint and stop disease outbreaks today. It was only after the Spanish influenza pandemic in the early 20th century that the investigator Wade Hampton Frost realized the rates of pneumonia had been unusually high in the months leading up to the massive outbreak of the flu in the U.S. Army camps. Looking back, Wade suspected that the doctors had been calling pneumonia had really been cases of Spanish influenza. If someone had remembered the lesson of John Grant and looked into the sudden jump in pneumonia cases, it might have led to an earlier identification of the illness. The Spanish flu swept through the United States before going global and killing millions worldwide in the winter of 1918. In 2019, when doctors in Wuhan, China noticed more pneumonia cases than usual, they were quick to let the authorities know, hoping to avert another pandemic, but the virus had a head start.